My name is Jeffrey Jenkins. And this is my public health mini talk of chronic diseases in southern states. My main source that I use is the article "Cardiovascular Health Discourse Among American Adults in the Southern United States" by Pope, May 2021. The issue of unhealthy food options leading to chronic disease in primarily southern states. One of the most pressing public health issues in America right now, particularly in southern states, is the high prevalence of chronic disease and cardiovascular disease. And typically, and most prevalent, that is caused by what you consume, such as heart disease. Such as fast food. If you lead a healthy lifestyle, um, then you might be vegan or vegetarian. But what my public health mini talk is basically um, going to talk about are the health issues of primarily minoritized subgroups of people in America in the southern states, because the University of Alabama conducted a study in 2021 where a significant trend of cardiovascular disease risk factors were found in Alabama and other southern states. According to the article, these risk factors were disproportionately concentrated among those living in the southern states and contributed to the higher prevalence of cardiovascular death in this region. So, heart disease and cardiovascular risk factors are more prevalent than ever in southern states um, as of 2021, ever since they did this research, and probably was even more prevalent before then. But what they're saying in the article and research is that the prevalence of cardiovascular disease, chronic health disease, what these people in these southern states, predominantly black, consume are basically killing them slowly. Because in these typical areas, there might be food deserts, or just might not be enough access to healthy foods to lead a healthy lifestyle. So these individuals in these neighborhoods can lead a healthy lifestyle, and I'm also going to get into that too in these slides. Why is cardiovascular and chronic health the poorest among individuals in the southern states? According to the article, cardiovascular health is poorest among American adults in southern United States. The Mayo Clinic proceedings team of UAB found significant geographic distribution of cardiovascular disease risk factors such as diabetes, hypertension, high blood cholesterol levels, obesity, smoking, lack of physical activity, and unhealthy diet concentrated in the southern states. From Dr. Parcha, MD, a clinical research fellow in the UAB Division of Cardiovascular Disease, stated only 1 in 6 Americans has ideal cardiovascular health. This is worse for southern states, where the prevalence of ideal cardiovascular health is only 1 in 10 persons. Data in relation to which group is diagnosed with chronic and cardiovascular health issues the most. They also found that in the largest study of the geographical distribution of cardiovascular and chronic disease risk factors that UAB conducted, and there was strong correlation and evidence between the prevalence of poor cardiovascular health and cardiovascular mortality among Black individuals. In the research and data on the geographical distribution, the UAB team found great evidence that social factors play an important role. And when I talk about social factors, I'm talking about what restaurants these individuals with heart disease and cardiovascular risk factors were around, where did they live, where they lived is probably the most pressing issue, because where they live probably didn't serve them well enough to provide them with good enough resources to um, lead a healthy lifestyle with what they consume. Um, that's why the cardiovascular health issues are more prevalent in these black individuals, in these black communities, in these black neighborhoods, in southern states, um, because simply put, that is where um, unhealthy lifestyle choices are put in those neighborhoods and communities for exploitation among individuals who don't have enough money, income, revenue to to lead a healthy lifestyle. And that is, as we can see from the research, typically in black neighborhoods and communities. Risk factors for cardiovascular disease that these communities face are high calorie foods, fast foods, even more so fast food delivery services like DoorDash and Uber Eats make it even easier for people to consume unhealthy foods at a faster rate. Limited access to healthy food options, like I said, food deserts, and the effects of these causes are increased rates of obesity, higher rates of related health problems, and disparities in health outcomes. Let me just check my time. Addressing the high rates of chronic disease in the South requires a comprehensive approach that involves multiple stakeholders, healthcare providers, policymakers, and community organizations. Some strategies that have been effective in reducing chronic disease rates because of increasing access to healthy food options, implementing policies that promote physical activity, and providing education and support for lifestyle changes. Additionally, addressing poverty and other social determinants of health can create more equitable access to healthcare and preventative services. The high prevalence of chronic diseases in the southern United States is a significant public health issue that has a profound impact on individuals, families, and communities. And just to recap about everything I've covered so far, if there are any questions or you want to dive into this discussion even further, please tell me what protocols or policies might you have to let individuals lead healthier lifestyles in these communities, help them achieve healthier bodies and healthier minds.